What Cornwall Hospice Care has also done over the last few years is really be at the forefront of development of what makes a difference to patients. So if I look back over the 27 years that I've been working in Cornwall Hospice Care, very early on in the 1990s, I started doing a clinic jointly with one of the oncologists at the Royal Cornwall Hospital. And what we evolved was a seamless way of looking after people so that if they had cancer, they'd have seen me in the clinic. And then when it came to the point where maybe active treatment wasn't going to make any more difference to them and we needed to be focusing on keeping them comfortable, they would be seeing me seamlessly and that would not be threatening. And I could start introducing ideas and services to them that they might not have wanted to think about otherwise. People now go on being treated and fight their illnesses for a very long time, right till the end sometimes. So sometimes those patients were having active treatment as well. And what we've got now is a system in Cornwall which has been evolving since I started in the 1990s, where we've got consultants sitting in oncology clinics. What they're doing is identifying patients early and giving them the same kind of care I've just briefly described. And what we can see now is happening nationally is there's a move to provide the care that we've been providing in Cornwall since the 1990s to everybody who's sitting in cancer clinics, and the government are throwing money at this now, and it's recognition that we were ahead of the curve, and a lot of the things that they're looking to measure now are things that we've measured and demonstrated already in Cornwall. So we're kind of the tip of the toe of the map, but we're not the tip of the toe in terms of how we develop and how we deliver services. What we've also had running in Cornwall since the 1990s is a combined approach to people who have very difficult pain and how we best deal with those patients. So for most people who have pain, most palliative care will deal well with 90% of that pain. So if somebody's got pain, then I would be saying they should be confident that the pain and the distress can be relieved. But there are 10% of people who have a very difficult pain indeed. And what we've had running since the 1990s is a joint service with the pain team at Royal Cornwall Hospital, where we can use techniques that are not used in a run-of-the-mill way in palliative care to control and deal with difficult patients who have difficult pain. And so some of these developments have been recognised in terms of the difference that we're making. So the work that was done in the oncology clinics was recognised, and we were nominated as the BMJ Palliative Care Team of the Year for that. What we've also done in the county is work collaboratively with other providers, and Cornwall Hospice Care was a key part of rolling out a project to make sure that if you are in pain, if you are distressed, if you are dying and you need symptom control, and people don't know what medicines to use, we've got a protocol that uses drugs that and tells people the doses of the drugs and how they should be used. And we did a project maybe 4 or 5 years ago now, where we rolled that education out to over 1,000 healthcare professionals in Cornwall, and that piece of work also resulted in us being nominated for a BMJ Palliative Care Team of the Year award. So what we're doing as on the back of our normal everyday working lives is developing and innovating and then feeding that back in so that it improves things in the future, not just for Cornwall but elsewhere nationally and internationally. And some of that is being recognised by our peers from outside. So what has Cornwall Hospice Care done for us? It's done lots for this county.